What is bronchoscopy used for in lung cancer? Imagine being able to look inside your airways without surgery. That's what a bronchoscopy allows doctors to do. It is a procedure where a thin, flexible tube called a bronchoscope is inserted into the airways through the nose or mouth. The bronchoscope has a tiny camera and light at the end, which helps the doctor see the lining of your lungs and airways clearly. This tool is essential in diagnosing and understanding lung cancer. When doctors suspect lung cancer based on symptoms like a persistent cough, coughing up blood, or abnormal imaging results, they use bronchoscopy to get a closer look. During the procedure, they can identify suspicious areas that might be cancerous. They can also collect tissue, cells, or fluid samples directly from the lungs for laboratory analysis. These samples help determine if cancer is present and what type it might be, such as small cell or non-small cell lung cancer. There are several ways to collect samples during a bronchoscopy. The most common is a biopsy, where small pieces of tissue are taken using tiny forceps passed through the bronchoscope. A brush biopsy uses a small brush to gather cells from the airway surface. Bronchoalveolar lavage involves flushing saline into the lungs and then suctioning it out to collect cells and fluid. For nearby lymph nodes or masses, a transbronchial needle aspiration uses a thin needle to take samples, which is especially useful for staging the cancer. Staging is a crucial part of understanding how far the cancer has spread. Bronchoscopy, especially when combined with endobronchial ultrasound, helps doctors examine lymph nodes in the chest without needing surgery. The ultrasound probe attached to the bronchoscope guides a needle to sample these lymph nodes. If cancer has spread to these nodes, it influences treatment choices and prognosis. Advances in technology have enhanced bronchoscopy's capabilities. Techniques like autofluorescence bronchoscopy and narrowband imaging can highlight abnormal areas that might be missed with standard light. Newer tools like optical coherence tomography and confocal laser endomicroscopy provide detailed images of the airway lining, potentially catching precancerous changes earlier. These innovations are still being studied but show promise for improving early detection. Typically, bronchoscopy is performed as an outpatient procedure and takes about 20 to 30 minutes. Patients usually receive medication to help relax and may feel some numbness in the throat. The procedure is generally safe, with rare risks such as bleeding, infection, or a collapsed lung. Before the procedure, patients might need to fast and adjust medications, especially blood thinners, to reduce risks. Beyond diagnosis, bronchoscopy can also be used to treat certain issues caused by lung tumors. It can help remove blockages, place stents to keep airways open, or control bleeding. However, its main role remains in identifying and staging lung cancer, which guides treatment decisions. In summary, bronchoscopy is a vital tool in the fight against lung cancer. It allows doctors to look inside the airways, take samples for testing, and assess whether the cancer has spread to nearby lymph nodes. This information helps determine the best treatment plan and improves the chances of successful outcomes. Always remember, if you or someone you know is facing lung health concerns, consult with healthcare professionals to get personalized advice. This procedure is safe when performed by experienced specialists and provides critical insights that can make a real difference in managing lung cancer.